Hello, my name is Kyle Moore. I'm a student physical therapist assistant at Jeff State. And today I'm going to be talking to you about lymphoma. So first we'll talk about what lymphoma is, how it may affect somebody, common treatments given, and what physical therapy needs to focus on. So what is lymphoma? It is cancer that originates in the lymphoid tissue or the lymph nodes themselves. It can be present and spread to other areas as well, such as the CNS, bone, stomach, places like that. It affects B lymphocytes and T lymphocytes. And there are two types. There's non-Hodgkin's lymphoma and Hodgkin's lymphoma. Non-Hodgkin's lymphoma, there are 61 types under this category. The exact cause isn't really known, but in general, it's the malignant transformation of lymphocyte at a specific stage of B cell and T cell formation. The malignancy then multiplies, causing a tumor and enlarged lymph nodes. Hodgkin's lymphoma, also known as Hodgkin's disease, it is named after Dr. Thomas Hodgkin, who first discovered it. There are 6 types of Hodgkin's lymphoma, and it's not as common as non-Hodgkin's lymphoma, and it involves Reed-Sternberg cells. So these are large, abnormal B cell derived cells. It is a B cell type malignancy with clonal growth of B cells. Reed-Sternberg cells inhibit T cell activation, which hinders the destruction of abnormal cells. So right here we have our Reed-Sternberg cell. As you can see, it's much bigger and looks different than these cells around it. So diagnostic procedures. So some common symptoms one might have with lymphoma are night sweats, fever, unexplained weight loss, fatigue, and things like that. Physical examination of lymph nodes, liver, and spleen can be done if lymphoma is suspected. Also, biopsy of the tissue can be done to rule out cancer or not, or if the presence of Reed-Sternberg cells are present. Other biopsies and imaging tests such as MRI, spinal tap, those kinds of tests can be used to determine if the cancer has spread to other areas of the body. Staging. Staging is used in this cancer and any type of cancer to determine where the cancer is at as far as pathology speaking. NHL uses an Ann Arbor staging system, which is stages 1 through 4. Letter E could be added to the stages which show that there's involvement outside the lymphatic system, any organ outside the lymphatic system, and S can be added to show that there is involvement with the spleen. Hodgkin's lymphoma uses Cotswold system, which is a modification to the older Ann Arbor system. Who is at risk? So we have older individuals who are more at risk than younger, men more than women, people in more developed countries are more at risk than non-developed countries. People with immune system deficiencies, such as people with HIV or organ transplant recipients, can be more at risk. Chemical or radiation exposure. And for non-Hodgkin's lymphoma, autoimmune disorders such as RA and lupus can increase risk factors. And for Hodgkin's lymphoma, previous exposure to the Epstein-Barr virus or close family history can increase risk factors. Prognosis. So for NHL, the 5-year survival rate is 69%, and the 10-year survival rate is 58%. So it's not too great. For HL, it's much better. For 5-year, we have 84%, and almost 94% for individuals who are diagnosed with HL before the age of 45. So it's pretty awesome. And HL is considered one of the most curable forms of cancer. Medical treatments, these are pretty common with just about any cancer. So we have chemotherapy, immunotherapy, radiation therapy, stem cell transplant, and for Hodgkin's lymphoma, they can do monoclonal antibodies. So here's a study looking at a treatment with a few combinations of drugs, 5 or 6 drugs, with filgrastim, patients who had metastatic B-cell lymphoma without radiotherapy. The 5-year survival rate for the patients in this study was 97%, which is really awesome. Follow-ups ranging from 10 months to 14 years, all but 2 of the 51 patients were in total remission. Alright, so here's some common impairments, functional limitations, and disabilities. So we have generalized weakness, imbalance, decreased endurance, impaired mobility, skewed kinesthetic awareness, lymphedema, and pain. And here's some practice patterns. Most of these focus on improving posture, strength, aerobic conditioning, skin integrity, even circulation, and impaired motor function or sensory function. Physical therapy interventions. So we have client and family education, managing pain, gait training, therapeutic exercises, which is pretty big, balance training, aerobic exercise, and possibly lymphedema management. And here's another study with lymphoma patients. So 61 patients were split up into 2 groups, an exercise group and a non-exercise group, and the exercise group performed aerobic, sensory motor, and strength training exercises. And basically what they found that the exercise group was successful in improving quality of life and reducing extra risk factors associated with the cancer, as well as improving their quality of life while they were undergoing treatment for the cancer. So it's not too surprising, but it's kind of cool and reassuring that exercise does indeed help. All right, precautions. You want to monitor lab values such as white blood cell count, red blood cell count, platelet count. White blood cell count, if it's too low, they could be more susceptible to infection, or too high, they could already have an infection. Red blood cell count, if it's too low, they can get anemic during exercise. Platelet levels, if those are too low, they can be more susceptible to bleeding or bruising. Contraindications, so you don't want to do E-stim or hot pack, especially over malignant areas, so we don't want to cause growth in the tumor or possibly allow it to spread. Implications, so compression sleeves can be used in therapy to reduce swelling, especially if lymph nodes get removed. Sometimes they're swelling. So, okay, and effect on treatment plan, goals, and progression in physical therapy. So these are some things to consider. So what kind of medical treatment are they receiving? So if they're receiving a high dose of chemotherapy, then they may not have that much energy all the time. Their current health status. So their age, stage of cancer, comorbidities, and activity level are important considerations. How motivated are they to do therapy? So you would hopefully want to motivate them to do therapy to improve their condition. And what goals or activities does the patient want to work towards? So is there anything that they want to do that they previously did before diagnosis? Or is there anything that motivates them or that they want to do currently? So including patients and their own goals is very important. So summary of key points, we have non-Hodgkin's lymphoma and Hodgkin's lymphoma. Common treatments: chemotherapy, immunotherapy, radiation, monoclonal antibodies. And PT interventions are going to focus on improving strength, aerobic conditioning, balance, and possibly lymphedema management. So, closing discussion. First off, we want to make sure that lymphoma or any type of cancer is detected early. So if there's any weird symptoms mentioned before or any others, make sure you go see a doctor and get it checked out, because early detection is going to increase likelihood of survival, and It's going to make the treatment process less demanding and not as hard. Safer and more effective treatments. So like the first study I showed, we want treatments that are more targeted and safer towards removing the cancer and without causing a lot of harm to the patient, and kind of increase their level of well-being while undergoing treatment. So some of these treatments, especially chemotherapy, have horrible side effects later on down the road, even after the cancer is gone. So finding better and safer treatments are important. Emphasis on exercise and improving health and quality of life. So like we mentioned before, exercise is going to improve their strength, aerobic conditioning, all that to help better cope with the cancer and the treatments that are given. So I hope I was able to teach you a few new things, and thank you for watching.